Well, this afternoon we have heard a broad spectrum of perspectives, and it's all about virtual care. Lots of different perspectives from the farthest points of the world all around the United States. So to bring it all together and into a series of next actionable steps, I'm very honored to lead a closing conversation with some industry leaders who bring a real diverse expertise to the table. Notice I'm facilitating 4 celebrity executives. We'll spend a moment to give some thought together about how to best unlock the opportunity amidst the macro forces that we face in healthcare. So please welcome the panelists. You'll see on the screen, I'm going to read their names and you can see their titles. Dr. Ritika Kumar, Dr. Yulin Wong, Jim Winkler, and Anne Mond Johnson. Very good. It's a very powerful panel, so thank you for being here, everyone. I really appreciate it. And that was terrific to hear from Dr. Oz, wasn't it? It was great, directly about the healthcare priorities for the administration and his thoughts on how health plans, employers, and health systems can collaborate and work together and partner with CMS. So, my first question, maybe I'll start with you, Anne, if that's okay. Mm-hmm. As a community that's passionate about virtual care, and I know we all are, what are your thoughts about how we best collaborate to shape the future?
Well, thank you, Andy, and it's great to be here with all of you. And I want to thank Dr. Oz on behalf of the community for his incredible leadership and support for expanding access to digital and virtual care through technology. These moves clearly help modernize the healthcare system. It empowers patients and reduces unnecessary barriers to care. And an important indication of commitment on the part of the administration is the permanent extension of the first dollar coverage for high deductible health plans. That was an important win. And now 35 million people with HSA eligible high deductible health plans can access critical telehealth and remote care without touching their savings accounts. And this is really due to a huge effort on the part of the community, a lot of advocacy. I want to give a shout out to Teladoc Health for their support, and in particular Kevin Harper for his leadership on this for the last several years. And I would like to think that the win is a harbinger for what's to come. That's being the eternal optimist. The proposed physician fee schedule rules have many elements that focus on modernizing the healthcare system, and it's critical that we advocate together because doing it together really gets results. So single company efforts, I think, more often than not, fall flat.
Well, and I appreciate the call out, but thank you to you for leading such advocacy efforts too in such crazy times. I know you went through COVID and you've now been part of what's going on now. So really appreciate your involvement as well. And Kevin too, for sure.
Absolutely.
Yeah. All right. Dr. Kumar, how about you? Any thoughts about that, how to collaborate?
I'd say so many thoughts, but that would take more than 30 minutes. So I'm going to
sit back. We're going to have a little bit of time.
I'm going to say I'll bring my bias as an internist to the table, but I'm now on the so-called darker side of healthcare on the plan side. But we all have the same goal, and what we're all trying to do is solve for improving access to care and improving people's outcomes. And I've always said this, that it's long past due that healthcare brings consumerism to the table the way that all the other industries have. We've always asked the horse to come to the water, and it hasn't been about the patient. And we're finally in that era where we're meeting people where they are and providing them the services in a convenient fashion. And telemedicine or virtual care solves for so many problems. And to me, it was truly the silver lining of the pandemic, where in the past, you couldn't give it away for free. And people learned a new way of accessing care, and providers learned a new way of delivering care. And for behavioral health, it's truly helped with stigma. And we personally, in our family, dealt with a lot of challenges during the pandemic. And if it weren't for virtual care, I don't know how I would have survived working, virtual schooling, and taking care of 2 kids with severe allergies and severe anxiety.
Oh, yes.
So, plenty gray hair, well hidden today, but I would say thank God for where we are in healthcare and where we're headed, and all the partnerships that will help us hopefully get to a place where we're working on keeping people healthy and not, treating end stage of disease.
Excellent, excellent. Jim, thoughts?
Yeah, sure. So first I'll start. I represent an organization called Business Group on Health, and to Ann's point about single organization efforts often fall flat. We exist as a multi-stakeholder community. Many of you work for organizations that are member companies. We have 450 members with 60 million lives, and we look at these issues through that holistic lens. And we've been big fans of telehealth from the get-go, including, as you just alluded to, the important dynamic of the role it played in addressing care during the pandemic, in particular mental health, right? So the mental health crisis around the world shows no signs of abatement. The good news is, in many parts of the world, led by the underage 30 generation that I still pay a lot of bills for in my household, they've destigmatized it, which is awesome. We've also, through virtual care, started to address access issues. Right now, we have the opportunity to continue to lean into how to improve quality of care and consistency of care, and ultimately address cost. There just simply isn't enough bricks and mortar, so telehealth, virtual care plays a critical role in that. And I think all of us collectively, whether you represent an organization that sells a product or a service, or you're an employer that uses that product and service to meet the needs of your workforce, we all have to work collaboratively to address these issues.
And you mentioned the under 30 crowd destigmatized mental health. If you're a friend, ask your friend, are you okay?
Yeah.
It starts there, just awareness. So I appreciate that. In our opening session, Chuck talked a lot about frictionless or seamless care as well, and there's no doubt that that's the kind of care we all want to experience for ourselves, our families, and our communities. Let's move to data and technology, which can help facilitate that. Maybe I'll start with you, Yulin, and we'll ask the question, how do you think data and technology are essential in the reality, and what priorities might be there to focus on?
Well, thanks, Andy, and they're essential. So that was it. No, actually, no. I think that it's an exciting time to be a technologist in healthcare because, in terms of frictionless, I would suggest that virtual care has already done a lot in terms of reducing friction because of ease of access.
Right.
I mean, probably everyone here has either directly or family members gotten care at home, at nighttime, in the morning before offices open, et cetera. And that's just one of many, many examples of, I think, what's going to continue to happen in years to come here. I think there's two big buckets of technology that are worth mentioning here in answer to that question. One is this category of virtual care or digital health. And that's actually not only includes the ability to interact, but it includes things like unique sensors, where you can actually see someone's heart rate by just looking at their face. You can see if they're struggling, perhaps, mentally by even analyzing their facial expressions. You can do stuff like, all these amazing things with sensors combined with virtual care. The other one, which is huge, and I know it's a bit overstated these days, but it's very important, is the whole area of AI. And AI is in a transformative time right now, the beginning of it. I would sub-bucket that into maybe three different components of AI. The one which has really kind of stepped us forward in a big way is generative AI, and that's where the data comes in. Another one is this, I'm sure everyone here has heard the word agentic AI, which is actually where the AI can start interacting as almost a persona onto itself, as opposed to just kind of a query kind of thing. And then the last one you might call is physical AI. And I think in healthcare, physical AI is a big deal because that's using AI in interacting with the physical world. And so I think that, in summary, using these technologies, we can certainly make continued significant progress to what Chuck referred to earlier as frictionless care.
Yeah, AI is typically just a term sometimes thrown around. It's a strategic tool in our toolbox to solve problems that are meaningful for all of us.
That's exactly right.
Yeah. Jim, any thoughts?
Yeah, so I think outside of a room like this, if you said healthcare and frictionless in the same sentence, you'd get a lot of dirty looks, right?
I think you're right.
We've got,
We can't
we've got
see 'em
some,
right now.
We've got
It's
some
an
ways to go.
oxymoron.
But I think everything you just talked about is really important in that journey forward, right? Because you think about, for all of us as individuals, we want things to feel connected in our health journeys, right? Our physical health, our emotional health, I'd argue our financial well-being plays a key role in all of that. And we all want sort of one doorway, right, to access the system. The challenge is that in this room of 400, 500 people, we want 500 different doorways, right? And so as a technologist or as an organization, like Teladoc, you need to think about how you're crafting that. And I do think that's where technology and AI can play such a great role in making us all feel like the door we're entering is my door, even though it all behind the scenes might be one and the same. Because I think fitting those pieces all together and not having the 5 apps on my phone that I have to try to remember which one to use is really important. And through my lens, in the world of employers, one thing employers are really looking for is that interconnectivity and frictionless system, not only for the employees, but for how they think about and manage the program as a steward of the program, right? I can't have a situation where I have 5 different vendors taking credit for that well-managed diabetic, and then 5 vendors blaming the other 4 when there's an ineffectively managed diabetic. So putting all those pieces together, whether those are in our benefit hubs, in an app on my phone, in a combination of bricks and mortar and telehealth, making all those connections come together, leveraging technology as you just described, is really the key.
Great. And so, Anne, maybe any other priorities that you would outline for data and technology?
Well, I think, again, the challenge is with huge imbalances between supply and demand. The only path forward to remedying this is to use clinically validated and almost infinitely scalable digital and virtual care services. If you don't digitize it, you can't scale it. So earlier this year, our affiliated trade organization, ATA Action, acquired Digital Therapeutics Alliance, which really was intended to broaden the advocacy and the policy and the advancement aperture for digital health, because the challenges that we have, be it digital therapeutics or digital health, they're all addressing the patient journey, and there are all sorts of issues along the way. So the current administration has indicated that digital health technology, namely telehealth and remote monitoring as examples, has a role to play in the administration's push to treat chronic disease. And CMS has said something, quite frankly, that is music to our ears, which is that as technology advances, more services may be safely furnished by telehealth. It is increasingly important for physicians and other clinicians to exercise their professional judgment in determining the generally appropriate service modality for their patients to receive a service. Amen, hallelujah, right?
Yeah.
Telehealth, digital health is health, and it should be available.
Well, it's clear that we've heard that virtual care can and it must do more than in the past. And we've heard a lot of examples of how we're all using virtual care to connect our experiences, to equip our care teams, and to perform at the highest caliber and elevate the experiences that are out there. So Teladoc calls that the era of orchestration. And what's exciting, maybe from your perspective, if you would share, are the connections and collaborations between virtual care and in-person care, which we are all now kind of saying it's just care. But let's start with you, Dr. Kumar.
I would say it's critical, and I think one of you said this when we were prepping. This is not supposed to be a microaggression, but I'm giving credit where it belongs. It's making sure that it's high quality care, irrespective of how it's delivered. So I do agree with the point of view of let the physician or the clinician that's delivering the care decide what's the right modality of care. What that helps us do is, we've all heard there's dearth in access to primary care. Wait times are more than 30 days for a regular primary care visit. In specialty care, it could be as high as 6 months. And What virtual care allows you to do is to then triage those patients that don't need to be seen in person, have milder conditions, to be seen virtually. So you've now opened up your access points to bring in people that actually need to be seen more timely. The other piece is, there's still access to care issues, social determinants of health, right? Not everybody lives in communities where they have access to the best tertiary care centers or the best specialists. Not every oncologist knows what's the latest and the greatest, and maybe would like to have an e-consult with an oncologist sitting out of Penn or MD Anderson. Virtual care allows us to do all of that. It allows us to provide access to a broader array of specialized care and solutions. But I think in my utopic world, what I would love and what I envision is creating an ecosystem where you've interconnected and created that network of providers that can seamlessly, right, see that member, be attributed to that member as their primary care doc virtually. But if that member needs to be seen, they can then go into that same practice, whether that's the same provider or their colleagues, but you've got your medical records in the same EMR. You're not having to tell your story all over again or do testing all over again. There's a lot of medical waste that happens with all that. And then you've created a network of specialty care knitted around that, that's high value care that you could refer to, whether that's e-consults as opposed to getting someone seen. And the other piece that I support our entire employer block where 70% of our business is self-funded. And there's trades where taking the day off to go get care means you don't get paid. And what do most people do? Nothing's broken, there's nothing to fix, I'm not getting care. And I know Dr. Oz mentioned or they said hypertension is a silent killer. It is a silent killer. A lot of people are walking around hypertensive and have no clue they're hypertensive. So if you don't go get care and get screened, you won't know what's wrong with you. So with Teladoc, we're really excited that we're actually offering virtual primary care now, which to me, virtual care has been great, but it's also fragmented care in the past. What VPC allows us now to do is to be able to bring that primary care, holistic model of care into the home or that break room or wherever it's convenient for that employee to get care, get it timely, so that we're not spending all our healthcare dollars on catastrophic claims.
Right, and you're calling out what Jim was speaking to. I mean, employees are everywhere. They're in the living room, they're in the kitchen, they're in the dining room. And I have a feeling I know where you're going to land on this, but inpatient care and personal care and virtual care?
Well, I think the fun thing is that it's not an either-or proposition, that it's really leveraging technology to be more provider and patient-friendly, more effective, more personalized, and to Yulin's point earlier, more predictive. We have to use that to our advantage. So we have to think of digital televirtual care not as a modality, but part of a omni-channel access and care delivery system that's held to the same appropriate clinical, ethical, and regulatory standards as in person. So it's not separate care, but modern extensions of how care is delivered. And again, optimistic about the prospects for making Medicare flexibilities permanent to provide the continuity of care that we all need and to have confidence in our system that people will have access to care where and when they need it.
That feels like a mic drop moment right there, but Jim?
Yeah, it's always hard to follow Ann in these panels. When you think about this from an employer's perspective, while employers will spend a lot of time talking about how healthcare costs are growing at an astronomical rate and frustrations about the lack of visibility or transparency into outcomes and clinical data, at the end of the day, one of the most critical decision points for any organization when thinking about a new endeavor is the employee experience. And I think this is where virtual health has such a great opportunity to be a game changer in the way we think about engaging humans in thinking differently about their health. We do so much of our day-to-day life in a virtual-like environment, right? We transact things on our phone. I mean, how many of you are flying out of here today with a paper boarding pass for the airport? Anyone? No, right? You've checked in online, you've got your boarding pass, maybe you figured out how many Hyatt points you earned from your stay here. Like all of that's how we live our lives. And so virtual care just fits easily into that. And so I think letting that be the lever that helps drive the employee experience is critical. But as you think about a solution, and you come to an employer with a solution, if that solution is simply about managing costs or increasing access or measuring quality, but has a crappy human experience in terms of how people engage with it, or it becomes yet another thing, and I can't eliminate something else to offer your new thing, that's a real source of challenge or friction for an employer. So virtual care is this awesome thing. It works globally. I think it has the opportunity for us to standardize quality much more effectively than we can with bricks and mortar care, where care is really wildly different from city to city in this country and from country to country around the world. We can be much more consistent in that when we use virtual consistent platforms, but the experience for the individual has to work really, really well.
Yeah, well said. Well, I think it's a good time to move into innovation in the last few minutes that we have. And as you look into the future, what are some of the bright spots or bold new ideas that you might see on maybe this stage next year? So, Dr. Kumar?
We're actually exploring bringing in couple solutions together for some of our employer groups, where not only are we bringing virtual primary care to the table, but we're bringing access to tools that Ewan had commented on, where you could walk into this room that's been created like a clinic room at a school for this teacher, and you've got all the right devices there, and you've got what's a virtual stethoscope, and they can actually put it where the AI is directing them to put it, and the provider on the other side can actually hear and auscultate. So how do you sort of bring the tools of the trade that a clinician needs at their fingertips to be able to truly deliver high quality care to that virtual environment and make it convenient and make it easy? I think where we have an opportunity is there's still a lot of red tape around us as a country, where every state has different rules, and we're back to, if you're licensed in Pennsylvania, you can't treat someone who's sitting in Jersey. And at the end of the day, if I got a board licensure from Pennsylvania as an MD, you would think Pennsylvania has done their job to make sure I can treat someone in Jersey. And heart disease in Jersey is the same as heart disease in PA, right? So at some point, I'm hoping that we will do better administratively to truly think of what are the rules that actually help us versus what are the rules that are getting in the way of actually making care easy, accessible, and making it available to all. So, and I would also put in a plug to say that, I'm hoping that we also start focusing on making sure that healthcare is a necessity and a right for all humans, and shouldn't be a privilege that's only afforded to some. So.
And you were talking about use of a stethoscope. Dr. Wong, what about surgery? You're on your fourth company now, and I believe that your newest company is focused on robotic remote surgery.
Well, thank you, Andy, and it's a huge opportunity to be able to tell the group here what I'm really excited about, and to kind of back into that. I think if you think about healthcare delivery and define it as when a clinician interacts with the patient, what we've done so far, highly successfully, Teladoc has been kind of a real leader in doing this, is we've enabled the virtualization of the clinician-patient consult. And you can have more complex consults too. For example, you can have a stethoscope involved, ultrasound image, or what have you. But what we can do today is virtualize the consult. There's a whole other side of healthcare delivery, as everyone here knows, where the clinician needs to do something on the patient. And to do something on the patient, you can imagine things as complex as surgery. You could imagine interventions, whether it's catheters in the heart, catheters in the brains. You can imagine endoluminal procedures. You can imagine diagnostic procedures. All of those procedures today, you have to go into the office for, see the doctor in person. What I'm working on, and I'm very excited about it, is enabling the virtualization of all of those sides too. It turns out that there's a whole movement afoot where hundreds of early stage companies are building robotic replacements to the mechanical tools which enable things like interventional procedures, surgery, et cetera. And it turns out these robot tools are fundamentally built with two sides. There's the side the clinician manipulates, and there's a side which manipulates on the patient. And it turns out that you can separate those two sides by distance. And so the thing I'm working on is to enable all of those robotic tools to separate. And if you can separate them, you can do things like remote surgery. I flew in, although I live in California, I flew here from France because I was at a meeting just prior to this one called the Society of Robotic Surgery. And what we demonstrated at the meeting just a few days ago was the Intuitive Surgical's Da Vinci robot, where the surgeon was in Strasbourg, France, and the patient, and it wasn't a human, it was just a preclinical patient, was in Atlanta, Georgia. And then we showed that on stage. And then Medtronic, they have a robot called Hugo, and we showed a similar situation, surgeon in Strasbourg, patient in Paris. And so the point is that this evolution of enabling virtual care is not stopped where we are today, as in the consult. It's going to extend across the healthcare delivery continuum, I believe. And then when that happens, you can actually really transform healthcare.
It is an evolution, and so too will this conversation be next year.
Yes.
We'll see what all the progress is that we have all talked about. So I want to thank you all very much. We're out of time, but I'm inspired by what's next and grateful to be on the stage with you all. You're very much luminaries in what is the evolution in virtual care, so thank you for that. And I'd like you to all say thank you to these speakers.
Thank you.